Ladies, listen up. Guys, listen up. Chances are you have a woman in your life, be it a spouse, a sister, a friend. 1 in 3 women will die from heart disease. Managing high blood pressure can really be a challenge. WFMY News 2's Sydney Moore spoke with one Greensboro woman who learned how to manage her blood pressure with the help of her doctor.
Born and raised in Greensboro, family and hobbies have always been a priority for 64-year-old Brenda Morrison.
Just enjoying time with them. I have a great granddaughter. I love spending time with her. I love to cook. I love to bowl.
Those activities came to a halt 3.5 years ago when she started feeling shortness of breath.
So I went in, took a shower because I was going to take myself to the emergency room. And I think that the water, it exasperated and got me really to the point to where I could not even hardly get myself dressed.
Her daughter, home at the time, immediately calling 911.
They wanted me to walk out to the stretcher. I couldn't do it.
She says she felt like she couldn't breathe, describing it as one of the scariest moments of her life.
They worked on me and got me to the point to where I was able to breathe on my own. My blood pressure started to come down, and I was in the hospital for almost a week.
There is where she met Dr. Kardie Tobb, a cardiologist with Cone Health who helped guide her through lifestyle changes.
I had doctor's appointments with her, and we would sit and talk. And that is one of the joys of having a doctor that would sit in front of you and talk with you, listen to you.
Brenda is an incredible woman. What was unfortunate in her situation when we did her echocardiogram, meaning the ultrasound of the heart, which really tells me how the heart pumps, that pumping function, it was abnormal, highly abnormal. We want that number to be over 54, normal for women, and for her, she was pretty low.
Dr. Tobb says Morrison was open and willing to be put on a treatment plan. In her case, she needed at least 3 to 4 medications.
Using the right medicine for the right person, being in tune with the patient telling you what their side effect is and working together with them. And then that very important piece, not just only the medications, but what does that lifestyle look like? What are they doing?
Dr. Tobb says staying active, eating healthy, and staying on top of medications is key to managing high blood pressure.
And it showed how something as benign or something that we think is nothing, like high blood pressure, can cause someone to go into heart failure and can cause problems, and just working together and getting her blood pressure back led to her heart function being normal.
While Morrison is in much better shape and managing her blood pressure, not a day goes by where she doesn't think about how the diagnosis put her life in jeopardy.
Some things I don't take for granted.
She is living proof that with the right mentality and right support,
Dr. Tobb got me on track. She did.
better health is possible. In Guilford County, Sydney Moore, WFMY News 2.
All right, remember that stat, 1 in 3 women will die from heart disease. Let's unpack the symptoms and the solutions. So Cone Health Cardiologist and Clinical Integration Officer for Cone Health Center for Health Equity, Dr. Kardie Tobb, is joining us. You just saw her in the story. Let's talk about how common heart disease is in women.
Anya, thank you for having me here, and I enjoy talking to you always. Heart disease is very common in women. The common myth is that breast cancer is more in women, but it's heart disease. 1 in 3 women will die from heart disease or have some type of complications, so it is very important.
I think people think, okay, I'll pay attention to my heart health later on in life, but they may be missing the fact that they need to make their heart health a priority earlier on in life. So what age should we be looking at our heart health?
Starting a healthy lifestyle has to start from childhood, really. It should be a family affair. But when you start talking about adult women, think about when people are talking about their 21st birthday and how they're going to have a good party and get alcohol. They should really start thinking about how they can really get a primary care provider. They can be able to get blood tests, note their blood pressure, eating right, and looking at those numbers like their cholesterol and things that would keep them healthy.
Okay, so it's not at the age of 55, 60, 70. It is at 21. You need to start paying attention to what's going on with your body. All right, so Cone Health offering a free community event for women all about their heart health. Let's talk about that.
Yes, let's talk about it. So we're excited. This is our 4th annual Women's Heart Community event. We've been having this over the last years. Our theme is saving the hearts of women through education. So what that means is we're going to make sure that women in our community gets awareness of heart disease, how they can prevent it, how they can, if they're living with heart disease, what they can do to live a healthier life. Because remember, everything we do, if we start to practice what we do and get healthier, we're able to prevent heart disease. 80% of what we're telling you now of heart disease is prevented by knowing your number, knowing that this is, you can be affected by it. So that's important. Please come out on February 7th.
All right, that's February 7th, 8th until 1. Is it just show up, or do they need to kind of register ahead of time?
So it is, we will encourage people to register so we kind of know who's coming, but please, if you can register, it's not a requirement. It's something that we're asking, but show up. There are lots of activities. So we're going to have a keynote speaker talking about cardiovascular disease in women. But most importantly, I want people to know that we're going to be screening. We're going to be doing blood pressure screening. We're going to be doing blood work for blood sugar and the cholesterol. We're going to have our mammogram van there. We're going to do something called ABIs, where we're looking at the blood flow in the extremities, meaning the legs and the arms. So you don't have to really attend the whole event to be able to take time off and say run on your lunch break or write some break and come in and get screening done. So we're really asking women in our community, and if a male partner come with them, that's fine, they can get screening. It's important that everybody gets screened for cardiovascular disease risk factors, so that way we know how to take care of you and how to keep you healthier.
All right, mark that on the calendar, February 7th. I mean, so often we don't take enough time to do all those tests. So if it's all in one spot, that makes it super convenient. Okay, let's talk about some unique things that are unique to women that could increase the risk of heart disease that they need to be aware of.
So we do have traditional risk factors that affect everyone, including males. So high blood pressure, diabetes, high cholesterol, if you smoke, people who are inactive, and obesity, meaning that their body size is really bigger with their height. But when it comes to women, there are things that we want women to be aware of that is not usually talked about. So those emerging non-traditional risk factors. So women who had high blood pressure in pregnancy, we want them to understand they have high risk for heart disease as well. Diabetes in pregnancy, women who have polycystic ovarian syndrome, meaning PCOS, it increases their risk. Women who are going through menopause, menopause can increase because you're declining in that estrogen protection, the bad cholesterol is going up, the good cholesterol is going down, and also women who smoke. And these other women who actually have rheumatoid arthritis, even though that impacts males, but with females in those diseases comes the higher risk for heart disease.
Right, so if you heard any of those other unique things that could make you more susceptible to heart disease, you definitely need to be talking to your doctor about what you can do because of that.
It is very important. Talking to your doctor, I tell everyone, have a primary care physician provider, someone that you can actually relate to, someone you can talk to, tell them everything, they wouldn't judge you. You need to talk to your doctors, ask the questions. You also need to know when your blood pressure is taken, ask the person, what's that number? It is your number, you need to know it. When you get your blood work done, go through that number, and now it's so great where you can see the green and the red, just like the traffic light, red is bad. So when you have red, ask the questions, what can I do to bring this down? One of the things that I want people to be aware of when it comes for screening of a heart disease, males or females, there are different things that we're looking at now, something called coronary calcium scoring, which you don't have to have symptoms of heart disease, but if you have those risk factors that I talked about and you have a family history, very important. Family history is defined as your mother having a heart attack less than the age of 65 and your father less than the age of 55. You want to be asking your provider about a coronary calcium score. Another blood work that is not cholesterol, but it helps us understand if heart disease is going to be a factor for you, something called lipoprotein A. It is inherited. So if you have it, your risk factors for heart disease is going to go up, even for stroke and sometimes valve disease. That blood work, you only get it once in your lifetime. So it's important that people talk to their providers about this, and if they don't have the understanding, that we are here to educate people. And that's why you really want to come out, because if you get that information on Friday, February 7th, you can share it with your family members, neighbors, and friends, and people who you network with.
So let's talk about the signs and the symptoms of heart disease that are different in women than they are in men.
So I'm going to start by telling you that women can also have chest pain. And the same typical chest pain we talk about with the elephant sitting on the chest and, what we see on Hollywood. But what I really want people to understand is most women will not have that Hollywood sign. People will come in with shortness of breath. People will come in just having tiredness over days. People will come in sometimes. I read something today actually on LinkedIn from one of our cardiology colleagues who wrote that her patient actually had an MI and the only symptoms was back pain. So there's variety of ways that women can come in. But what I want providers to understand and the women to understand is when you are not feeling your right self, ask for help. Get help. If it's prolonging, please come to the hospital. Please get checked up because it could be something that you're sitting on that could be devastating if you don't get it checked out.
Yeah, don't just pass it off and say, I know I don't feel right, but I'll be fine.
Yeah. And we women, we take care of a lot of other people. We take care of our family members, our children. I'm a victim of that too. I have 2 daughters and usually I'll say, oh, you know what? I'm having a headache. I'll just wait. But no, make sure that you are cared for because that's important. You want to come in and that's what we're talking about prevention because you want to make sure you're knowing those numbers. You want to make sure you have a blood pressure cuff at home. You can be able to check that. And you want to make sure that you're checking out things that are not within your normal baseline.
Okay, besides the taking your blood pressure, what other prevention steps should women do to reduce their risk for heart disease?
So there are a few things, and you can be guided by what we call the American Heart Association Life Simple 8, but I'll just tell a few things. So one is eating healthy. Talking about the colorful plate. I'm not talking about the colorful plate with cheesecake and pineapple upside down cake or chocolate cake and looking at the different colors. I am talking about fruits and vegetables, making sure you have lettuce, making sure you have the carrots, making sure you have your protein, making sure you have your fruits, blueberries, strawberries, a lot of different things that are healthy. The second thing is you want to keep active. I'm also encouraging people to challenge yourself. Don't park near it to the nearest parking lot next to the elevator or next to the door. You want to park further. The little you do, the better it gets for you. If you're able to take the stairs, take the stairs, not the elevator. Secondly, we talked about knowing your numbers. I can't stress that enough. You can only be your own pilot or your own navigator if you know your numbers. So if you know that your blood pressure number should be less than 130/80, if that's high, you can do something about it. If you know your cholesterol numbers are high and if you're looking at that number is out of the range, you want to talk to your provider about it. If you know that your numbers are high for your hemoglobin A1C, ideally it should be less than 5.8. And if you're 5.8 and over, that's pre-diabetes. If you're over 6.5, you actually have the diagnosis of diabetes. You also want to make this a family affair. You want to encourage your kids at a younger age to start eating healthier and start being active so that way when they grow up, they're able to do it. One last important thing is you want to make sure that you're sleeping well. You want to make sure that you're getting at least 7 or 8 hours sleep. You're managing your stress as well. So all those things can be important.
All right. Thank you so much. You gave us a whole lot to think about. Maybe you need to be watching this with somebody else in your family. This is going to be in the To Your Wellbeing section of our website, WFMYnews2.com. We'll be right back.